So now we're going to do the lateral structures, which there aren't a whole lot, and then the anterior structures, and it's going to be bony and soft tissue because there's not that many. So we've already talked about the iliac crest and how you find that, and that's going to be really important for finding some of the lateral muscles. You have your glute, medius, and minimus. By the way, you cannot palpate the minimus because it's deep to the medius, but the medius takes up the entire posterior 2/3 of your iliac crest. The posterior part of it, well, the whole thing, the glute medius is really important in abduction. So if you are on that posterior part and you ask the people to push out, you should be able to feel that muscle push out against you. And then it's also going to help with internal and external rotation. So go ahead and bend your knee for me. So if you want to do the posterior part of the glute med, you have them push out against you. And then if you want to do the anterior, have them push in. And it's kind of weird that it does that, but it's a big fan-shaped muscle. And so because it connects to different parts of your iliac crest, it helps with different motions. So that's kind of important to know. Then we also have the TFL, the tensor fascia latae, that comes off the anterior 1/3 of your iliac crest and runs down, and that is the origin of your IT band. So if people are complaining of IT band problems, you can come all the way down and follow it to Gertie's tubercle, but they might have a lot of pain and spasm in this muscle. This muscle also is going to help with abduction, but it can also help some with hip flexion as well. So asking them to do abduction and then asking them to do flexion is going to help differentiate this muscle from your gluteus medius. And in addition, it also shouldn't really help very much with external rotation or any of that stuff. Okay, so then from there, what we're going to do, hopefully everybody can find their ASIS. The ASIS are the really big bony protrusions that pick up on the anterior aspect. So kind of like how we found the iliac crest and then came forward and found, or came backwards and found the Psis, we do the same thing, but in the opposite direction to find the ASIS. And when we're looking at pelvic positioning and all that kind of stuff, knowing where the ASIS and the Psis are really, really important. It's also where the sartorius originates from. So you're going to need to know that one as well when we talk about some of the other lower extremity stuff. The last bony prominence that I need you guys to know are the pubic tubercles and symphysis. So when you do this, make sure that you are explaining to your patient what you're going to do and that you are clear that you're not going to touch anything important. If you are going to be doing any palpations here and you're going to be doing it on a man, or a boy, or any of the male persuasion, I always tell them that they need to stand up, make everything go south, because nobody wants a surprise when we do this, and then do your palpation. This is actually a super important thing to do, and if you are, I would say a female doing this on a male, but even a male doing this on a male, it's a good idea to have somebody else in the room, and not just like one of their friends or somebody related to them, but like a colleague or something, or have video cameras in the room, which is helpful. Also, if you're going to palpate this, you want them to clear their hips first. So what they would do is, Anne kind of just accidentally did it, but you put them in the hook lying position, ask them to pick up their pelvis, lower back down. You can do it anywhere from 1 to 3 times. Then you passively tell them to relax and pull their legs out straight. And this is really important because if you're going to palpate this area, the way in which they lay down is going to affect how they're lined up. So you need to make sure that they are central. And the same is going to be true when you're looking at the ASIS and the Psis. Psis doesn't get quite as crazy as these guys do. So the best way that I know to do it is take the heel of your palm, the heel of your hand, not of your palm, whatever. Start at their umbilicus and gently push down until you feel a bony stop. That is going to be their pubis, okay? And the top part that's sticking out right there is the tubercle. You should be north of everything that they care about. I don't care what sex they are. And then you're going to push down and see if they are level. You can also roll up. So if I come in this direction and push down, they should also be level in the superior direction. If one is higher than the other, or if one is sticking out, so more superficial than the other, that isn't normal. You can also look to see if they are rounded, because they can either be sitting like this, or one can be rotated. If one side's rotated, you're probably looking at an innominate rotation. You'll learn more about that in the SI pelvis chapter, but those are the things you're looking at. And then in the middle of them is the symphysis pubis. So if they're complaining of things, and you guys are going to learn about osteitis pubis and pubic, mostly osteitis pubis, if that's tender right there, then trust me, they will make a face and be like, oh no, don't touch that. Now you're looking at a disorder that's pretty common in soccer players, which she did, football, wrestling, and a lot of other like running and constant sports. So those are really good areas to be able to palpate. From here, we're going to look more at the anterior muscles. So when we talk about these, the first ones that we're going to talk about are going to be your abdominal muscles. And the one that everybody knows and thinks about is the rectus abdominis, the one where like, I'm going to do 1,000 million contractions and I'm going to have this massive like 6 or 8 pack. Yeah. In general, my opinion is it's kind of the least important of all of them, even though that's the one everybody focuses on. So all of them, the rectus abdominis, the obliques, and the transverse abdominis, all help with contraction or compression of what's going on in your guts if they contract. And typically when we talk about the ones that have 2 parts, both sides need to contract together. So when we're going to talk about the rectus abdominis, this one helps compress and also helps with crunches. So as they come up, you don't even have to do a full sit-up. You're going to be able to feel these. The thing to remember is it's not actually, well, this is kind of a hard thing to explain. If you guys get to take the cadaver class, you will see that it's little bitty packets of muscles that are encapsulated in fascia. And so you actually have 8 individual muscles, 4 on each side, that work together to be able to help you come into flexion. Then just lateral to that, you have the external oblique, and deep to that, you have the internal oblique. When both of these muscles contract, they're going to help with compression. So what it is just making, and you guys can see when she did her rectus helps with that, the obliques help with that, and the transverse abdominis. So when you just squeeze, that is abdominal compression. Then if both the internal and external oblique on one side contract, they are going to cause you to do side bending towards the same side. So it doesn't matter, internal, external, same side, side bending. And then when we have them contract to do rotation, this is where it gets different. The external obliques help you rotate to the opposite side. So notice she has the left side contracting and she's rotating right. And then the internal oblique, when it contracts, she would contract, oh, nope. Haha, I had you go the wrong side. Oh. She's doing this side. The internal oblique does to the same side. So if she rotates towards you guys, so she is rotating to the right, she is currently using her left external oblique and her right internal oblique. What am I doing? You're going to the left. So same side, internal oblique on the left, external oblique on the right. Sorry, I'm getting confused because she's opposite of me on her right and left in what she's doing. But in general, if I rotate to my left, opposite external oblique, so if I'm going to my left, that means that my right side is contracting, and it means that my left side internal oblique is contracting, okay? If they both contract together, we do trunk flexion and compression. Then we have the transverse abdominis, which is low, so it's inferior to all of these. This guy right here is more of a horizontal muscle, and it actually goes pretty far around to our back as we do this. This is a really important muscle for pelvic stabilization. So when we talk about pelvic neutral and everything, critical for that. I happen to refer to this muscle as your get sexy muscle, because when somebody like good looking walks by and you want to be like, hey, people go, and they kind of stand up tall and they suck their gut in. A lot of that is your transverse abdominis. So when you're going to contract that, you're going to compress what's going on here and really kind of suck it in. So you would like pull in as far as you can, and you should feel that get really tight as they do that, and they should be horizontal kinds of muscle fibers. The last that we're going to do are deep muscles, and they're hip flexors, and they come off of your lumbar, the anterior bodies of your spine, and the anterior transverse processes are your psoas, and then your iliacus comes off the internal part of your iliac crest. Going back to short fingernails, you better have short fingernails. You also need to explain what you're doing, because palpation of these is tender for them. I'll just say that. You need to have them in the hook line position to relax their abdominal muscles and to relax these and everything so you can get through it. The iliacus, you just find their iliac crest and wrap around to the inside. It is tender. Tell them it's going to be tender. And once you're on the inside, put your elbow on their distal femur and ask them to push up against you. And they don't have to push very hard, but you should be able to feel that muscle contract up underneath your fingers a little bit, and they should be able to feel it as well. Then what you're going to do to get, you got to tell them to really relax, because to get to the psoas, remember where I said that they are, you actually have to get through their guts, okay? So what you're going to do is gently and very slowly start just inside of their iliac crest. I start a little bit more medial than that. So her midline is here, and I'm just an inch or two to the outside of that. Very slowly, notice very slowly. You need to make sure that they stay relaxed. Keep reminding them to stay relaxed. Notice my fingers are going deeper as I go, and you're gonna go down until you basically feel their vertebrae. That's how far you need to go. And then you're gonna put your elbow in the same place and tell them to gently, lightly flex their hip against your leg, and you should feel it contract, and they're probably gonna make a face when you do it. That is how you know that you are on those muscles. Again, very tender. The last thing that we're gonna do, and I purposely did her palpation on her right side because we're gonna talk about the abdominal aorta. The aorta comes off the left side and comes down, right? It's going to come more central as it comes through the body, but typically around the umbilicus, what you're going to do to find the abdominal aorta is just push down a little bit, not very far. It's actually, it's not crazy hard to get to it, and it's really strong because it's a huge tube, okay? So if you push down just a little bit and they're relaxed, especially in the hook line position, you should be able to feel a really nice, strong pulse. Can you feel that?
Mm-hmm.
Yep, it's just beating away in there, and they should be able to feel you pushing on it, and you should be able to take a pulse. This is not a common place to take a pulse, by the way. Do not just be like, hey, let me take your pulse and have them lay down and do this. But it's a good place to look at, because if they're having some kinds of problems, you think, in any one of these arteries as they go down, this is a good place to look at. Or if you think that they've had a lumbar or abdominal injury, you need to make sure that you can feel a pulse here, and then you're also feeling for distension or anything else, because if they have a AAA, which means that they have a tear or an aneurysm in their abdominal aorta, people will bleed out from that very, very quickly, and that is a major issue. And they'll start having distension and a lot of tension in their gut and pain, and it will not be good. So these are things that you need to know how to palpate. All right?